In this skill, we are undertaking the administration of an oral medication. As part of this skill, we will complete the 3 checks and 5 rights of safe medication administration.
First of all, before we begin the procedure, it's important that you check that all elements of the medication chart are checked and correct. And that includes the medication name, the date, the route that the medication is to be prescribed, the dose, the frequency, the prescriber's signature, and the prescriber's name. Essentially, when you're putting these times down, they must meet the recommended times. So the medication today is amoxicillin 500 milligrams, and this is for Mr. Daniel Hendricks. As I prepare the medication, if I was a nursing student, of course I would have a second person checking from the point of preparation right through to administration. I'm a registered nurse, so for an oral antibiotic, I am okay to administer this on my own, different to other medications which we will be going into in terms of IV, subcutaneous, etc. Before I start, I need to make sure that I've attended to my hygiene. When handling medications, some require you to wear gloves. In this instance, amoxicillin 500 milligrams, I'm not going to, but I'm certainly not going to touch the medication. So I've checked that the dose is correct. I've double checked this by going over to my MIMS online, and here I can check up medication in terms of what is the expected dose, what are the side effects, and if there are any contraindications to this medication. And I'm quite satisfied that this is fine. The dose meets the requirements for this person, so it's 500 milligrams 3 times a day or every 8 hours. Okay, so in preparing the medication, again, be mindful if necessary that you do need to wear gloves, then do so. I'm checking the name of the medication, I'm checking the expiry date, the dose. So again, on this capsule here, the dose, expiry date, all within range. 500 milligrams, check again. So I've got the medication out, 1 check. I'm checking again against the actual order. 500 milligrams. Amoxicillin, again I check on the 3rd check before I put it back. So I'm quite happy that this medication has been checked on 3 occasions. So I'm just going to put it back. I take the medication with me now to the patient. Hello Mr. Hendricks. My name's Kerry. As you know, I've been looking after you this morning, and it's now time for your medication. And before I give you medication, just need to do a couple of checks. First of all, can you please tell me your name and your date of birth, please?
It's Daniel Hendricks, 4th of April 1990.
That's correct. Are you allergic to anything that you know of?
No.
Okay, so the medication that you're having now is amoxicillin for your chest infection. You had a dose of that this morning, so it's now 2 o'clock, which is now due for your 2nd dose. Again, you're not allergic to anything, your identity is correct, so this is the amoxicillin. Are you right there with your cup of water? Okay, thank you very much, and I'll just sign for that. Please let me know if there's any problems with that, if you have any reaction or itchiness or anything. Sign that now. Thank you.